What's up, everyone? This is Greg with SportsRehabExpert.com. Today we're going to be talking about the hurdler stretch. This stretch is for you or those who are trying to improve hip internal rotation, some common mistakes that people make, as well as how to advance the exercise and use the exercise in the proper manner so that you don't get hurt, as well as try to work towards your mobility goals or flexibility goals that you're trying to achieve. All right, so that hurdler stretch is right here. This is the stretch that you'll see a lot of people do in track and field. Hurdle for a specific reason, because it looks like a hurdler or someone who's going over a hurdle. So this leg right here is what we're trying to emphasize for hip internal rotation specifically. Now, when you see people do this stretch, a lot of people will put their foot out like this. I'm not a huge fan of this. This is going to put a little bit more torque on the foot, as well as a lot of people actually lack internal rotation of the shin and ankle. So tucking the foot backwards underneath of you is my personal preference for the exercise. Not a huge difference if you do one versus the other. Just be aware that that could influence what you feel at the hip, as well as, again, most people tend to duck toe out a lot and they lack the ability to turn their foot in. So biasing that also helps with the foot, ankle, shin complex as well too. So this is my personal preference. So you can start here. Sometimes people are limited by this hamstring flexibility, and so you could take that away and do what's called a shin box stretch, which is right here, where we have internal rotation still the back stretch, but a lot of times this front leg is not any longer becoming the limiting factor. So to challenge you, you can go here, but right here is going to be the easiest for most people starting out. As you get more flexible and more comfortable in this position, more tolerant in this position, then straighten this back leg out. And what we can do to emphasize more internal rotation of this leg is we can lean backwards and start turning towards this side as well too. That's going to also create what we call a femoral nerve tensioner on this side, which many times can be the reason why people actually feel some discomfort in their front hip pocket or in their quad region, is because they lack nerve flexibility, not necessarily just muscle flexibility, but the nerve's tolerance to a stretch position as well too. So be sure to talk to a rehab clinician who understands the difference between muscle tension and nerve tension to determine if that's a specific need for you in your rehab plan. But this rotation towards that leg is going to emphasize hip internal rotation further here. You could do the same in this position here, where we rotate over top of the leg in this manner as well too. So these are all variations of the hurdle stretch to work hip internal rotation on this back leg. Choose what is correct for you at your current point of capability. You want to hold for at least 30 seconds minimum. Upwards of 2 minutes generally is the maximum length of time you'll hold in any one of these postures. Now, next up is the active mobility side of the equation here. So we want to actively try to engage this muscle by lifting the heel up off the ground. When you do this, you want to keep your pelvis pretty still. You don't want to feel like you're twisting your body to lift the heel up. We want to keep our hips, torso, everything above the pelvis nice and still. There's going to be a little bit of movement there, but we want to isolate just that hip rotation. You probably won't get very far, and that's okay. It might even feel like you want to cramp up initially. That's okay too. It's just positional weakness is the reason why cramping occurs, other than nutrition. So as long as you're hydrated, don't need to worry about nutrition. As long as you got your electrolytes, don't worry about nutrition. If you're cramping, it's because you have positional weakness. Again, this would be the easiest right here. Harder yet is right here trying to do it, and yours truly can't even do it in this position. So again, do what you currently are capable of doing. As this gets more and more easy for you, you can start to elevate the heel up off the ground, which makes it harder to lift up because you're creating a situation where there's passive insufficiency, where there's less leverage for your muscle to contract. So it's making the muscle work harder from an activation strength standpoint at that very end range position. Again, you need to be feeling it here, should not be feeling any pain or pinching in the front of the hip, and we want to minimize the amount of twisting that you're doing in the upper body and just isolate it to the hip right here on the side of the body. Now, as I mentioned in the video, this stretch, this position is going to be very person-to-person dependent. There are many people who lack a significant degree of hip internal rotation and are going to struggle in that position mightily without creating some type of substitution pattern in their pelvis or low back. So be careful when you're doing this exercise. Make sure you're not having any pain. Make sure you're not having any substitution. If you're unsure of if the exercise is correct for you, be sure to reach out locally to a trusted healthcare provider or online. We're happy to help you out too through an online consultation or through our workout rehab programs as we move back and forth and set video techniques back and forth through each other, writing you a specific workout program for your needs. If you're interested in that, visit sportsrehabexpert.com. You can fill out our form or questionnaire. We'll get back with you with the best scenario for your situation. And then if you're a rehab clinician or strength coach looking for more education, be sure to check out our courses as well too.